So moving on to chapter 12, patient relations and the dental radiographer. We'll first start by going over the learning objectives, and that is to define the key terms associated with patient relations, discuss verbal, nonverbal, and listening skills, and explain how each can be used to enhance communication, discuss how facilitation skills can be used to enhance patient trust, define a relationship of trust between the dental professional and the patient, and discuss the importance of first impression, chairside manner, and attitude, and explain how each can enhance patient relations. Skills that promote good relationships between individuals are termed interpersonal skills. The term interpersonal is defined as between persons. Technical skill alone are not sufficient for providing optimal patient care, and interpersonal skills must be used in conjunction with technical skills to enhance the quality of patient care. And this will include communication skills, which are divided as nonverbal, verbal, and listening. And just keep in mind that communication is a process, not an event. Also, will include facilitation skills. Facilitation just means it makes things easier. And then last is we'll talk about skills that promote good relationships between individuals. And as a dental radiographer, you should be able to function as a successful professional and have a knowledge of the psychology of individuals and groups that can motivate inter-office communication. So communication is a crucial interpersonal skill. Communication can be defined as the process with information is exchanged between two or more persons. Effective communication is the basis for developing a successful radiographer to patient relationship. Verbal communication involves the use of language. Your choice of words is important when talking with the dental patient. And some common phrases used informally in conversation can be off-putting in the professional setting and should be avoided. These are skills like, sorry about that. If this phrase is said too quickly without any eye contact, it could imply insincerity or insensitivity, or that you don't really have time for a true apology. So if you do have to say something like, sorry about that to a patient, just make sure you look them in the eye and express a sincere emotion of apology. Don't say things like, just relax, okay? This you might use with a nervous patient, but it doesn't comfort them and it just adds to the anxiety that is already present. That goes also with saying something like, calm down. This is like saying you're out of control and have lost all credibility. It serves to further agitate the patient and will only make them more mad. Don't say things like, I don't know. This can be interpreted as it's up to you to figure out. So when you don't know something, the appropriate response is, I don't know, but let me find out for you. Okay, also don't say, not a problem, or no worries. Okay, things like this indicate that there could have been a problem or they may have been a worry and negates the person's appreciation. So instead, when someone thanks you, it is best to respond with, you're welcome or my pleasure. Also, don't say things like, it's crazy around here today. Okay, this comment infers that chaos reigns in your office and it's not comforting to the patient and it serves no purpose to let them know that it's crazy around here. So good communication is the backbone of a well-run organization. So going on to nonverbal communication skills. So nonverbal communication involves the use of body language. Nonverbal messages that the dental radiographer conveys through posture, body movement, eye contact, and facial expressions are important when working with patients in the dental office. Nonverbal behavior can also be used to enhance communication. For example, If the statement, "It's nice to see you," is accompanied by a smile, consistency exists between the verbal and nonverbal communication. The verbal message is enhanced by the nonverbal message. When nonverbal messages are consistent with verbal messages, the patient is more likely to relax and trust you as the professional. Also, posture and body movement are important. An attentive posture and leaning slightly toward the patient with the relaxed still hands are nonverbal cues associated with interest and warmth. Also, eye contact is another nonverbal means of communication that is important in the dental setting. You should always maintain direct eye contact with the patient, and your eyes should never wander. Direct eye contact is associated with interest and attention and plays a powerful role in initiating and development of interpersonal relationships. Listening involves more than just hearing. Listening skills refers to receiving and understanding of messages. And careful listening results in better communication and less chance of misunderstandings. When listening to a patient, the dental radiographer can use nonverbal cues such as a nod of the head or facial expressions to convey appropriate emotional responses. So some tips about this is don't ever interrupt your patient when they're speaking, even if it's to finish their sentences. Don't ever do that. Let them finish their sentence first, and also give them your undivided attention. Facilitation skills are interpersonal skills used to ease communication and develop a trusting relationship between the dental professional and the patient. So these include asking your patient encouraging questions, answering the questions that they ask you, responding with action, and expressing warmth. So just keep in mind the term facilitation means the act of making things easier. So facilitative skills should enhance the patient's trust. And as a dental radiographer, you should encourage the patient to ask questions, and the patient should have a feeling that they are being cared for. In dentistry, the term patient relations refers to the relationship between the patient and the dental professional. So this includes first impressions, chairside manner, and attitude. These are all various kinds of patient relations. Also, the relationship between the patient and the dental professional is important. So the relationship between the patient and the dental professional first begins with first impressions. The patient's first impression of the dental team most often involves the dental auxiliary, specifically the auxiliary's appearance and greeting. So that means the auxiliary should always wear clean clothing and be well groomed. You should pay strict attention to personal hygiene, including hand washing and maintaining a fresh breath. In addition, the dental auxiliary should never eat, drink, or chew gum while working with your patient. So patients should always be greeted in the reception area by the proper title. If you look over on page 122, on that little box, that helpful hint box, it gives you some examples of what this sounds like. So first you'll want to address the patient by their title. You'll welcome your patient, introduce yourself and describe your role. Say something like, "It's a pleasure to meet you," and then tell your patient where you're going. So this would sound like this. "Hello, Mr. Jones. Welcome to the office. My name is Mike. I'm the dental assistant that will be taking care of you today. It's a pleasure to meet you. Please follow me." So the relationship between the patient and the dental professional develops as the professional works with the patient. And chairside manner refers to the way the dental professional conducts him or herself at the patient's chairside. The dental auxiliary must develop a relaxing chairside manner that makes the patient feel comfortable and at ease as well as convey confidence. So you want to avoid statements that indicate a lack of control or a confidence by saying things like oops, yikes, or uh-oh. The attitude of the dental auxiliary will affect patient relations. Attitude can be defined as a position of the body or manner or carrying oneself indicative of a mood. The attitude of all dental auxiliaries must be professional and should include such attributes as courtesy, patience, and honesty. So the dental radiographer must be polite and courteous toward all patients at all times. And you have to realize that some of these procedures are uncomfortable in dental radiography. And the dental radiographer must then be honest and upfront with the patient without scaring them or making it sound worse than what it really is. You want to actually be able to get through the series of x-rays without scaring them. And that's all I have for this chapter. If you have any questions, feel free to email me or else ask me in class. Thanks, and we'll talk soon.